Hello, I'm Dr. Dave Hindmarsh of Eaglescliffe Medical Practice. In this video, we're going to talk about prostate cancer. So, gentlemen, please listen in. So, prostate cancer is the most common cancer in males, affecting 1 in 8 of us in our lifetime. So, it's something that we need to be very mindful of. The problem is that post-COVID, we're not seeing the numbers of gentlemen presenting with this as we would expect. So, your prostate, I've got a picture right here of it, is a gland that sits underneath your bladder, and it's got your urethra, so your main pipe where all your wee comes out that it runs through. The problem is when it gets bigger, and this can be down to two causes: one, cancer, and two, a benign or non-cancerous cause, then with the main one being what we call benign prostatic hypertrophy. And because it's all to do with your plumbing, you can get a couple of symptoms with increasing urge to go to the toilet, and it can be really, really hard to go once you're there. And even if you do go, sometimes it can feel just like there's still some more that you really need to push out. And there are certain groups of men who are more at risk. So if you're older than 50, and we drop that down to if you're older than 45, if you're from a black background, and also if you've got a family history of prostate cancer. So think about your brothers, your uncles, your father, those sort of people, and that will put your risk slightly up. So within general practice, there are two tests that we can do: a rectal exam and a blood test, and let's talk through them. Blood test is called PSA, or prostatic specific antigen for short, and the issue with it is that it can give a high number of what we call false positive readings. These are readings where it comes back as raised and we think you may have cancer. We do all the investigations and it all comes back as normal, which is brilliant. The problem is that causes a lot of stress in the meantime. So to get over that, we need to make sure that we don't stimulate the prostate. So in that end, don't ejaculate 48 hours before the blood test, and also just don't have the blood test if you've recently had an operation on your prostate or you've had an infection in and around that area. So the prostate exam yourself is effectively a finger up your bottom so that we can feel how the prostate is. Is it smooth? Is it larger? Has it got lumps on it? Obviously, it's an intimate exam, so it'll be done in the privacy of the consultation room, and it needs to be done with consent. So if you really, really don't want it, you don't have to, but it's something that we just need to have a chat through, okay? If you've got a positive PSA or your exam's a bit odd, then we would refer you on to what's called a 2-week wait. Okay, this is a urgent referral where you'll be seen within hospital by a urologist within 2 weeks, and they'll discuss through your results and what they do next. And it can be a number of things. They may just want to keep an eye on it and do regular PSA testing, or they might want to do further imaging, such as an MRI, or maybe even biopsy it. Let them discuss it through with you, and they'll sort of discuss all the options there. So if everything's normal, but you're still getting bothered with these symptoms of needing to go to the toilet, we can start medications such as tamsulosin, which tries to shrink the prostate and sort of relieve some of those symptoms. So if you feel that you're at risk, so over the age of 50, over the age of 45 if from a black background, and if you think you've got a family history of prostate cancer and you're getting any urinary symptoms, please, please, please get it checked out. Please don't ignore this. The sooner we get it checked out and tested, the greater chance we have of treating anything if there is anything nasty there. Please, 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 if you found this useful, jump onto our YouTube channel at Eaglescliffe Medical Practice and leave a like and subscribe. If you feel that someone needs to watch this video, feel free to share it to them, okay, so that the message is spread, even if they're not registered with us, and they can go to their own general practitioner. Dr. Dave Hindmarsh of Eaglescliffe Medical Practice, please stay well.